What will you do to improve access to healthcare services for residents, particularly for the elderly and disabled? And we'll go to Susan this time.
I would really just repeat what I said earlier in the introduction. I don't think there's a magic bullet on this. I think we've got to be prepared to commit the resources. And I mean, I think with this whole thing about personal care and all of these issues, I hear people saying it's terrible that we don't have the money to do this. And then I also hear people saying it's terrible that we have to pay more taxes. And I mean, I think that there are some people who absolutely cannot afford to pay more taxes, and you know, they cannot afford a bottle of wine at the weekend. But there's quite a lot of people who can afford a bottle of wine at the weekend. And if you put 70 million of them together in the country, then you've actually got the money to do things in a proper way. So I was quite pleased to see this last budget putting up taxes. I think the Labour Party has been nervous about doing that, and I think this is what we need to do. We're still hearing that if Scandinavia and a lot of Europe have a higher tax rate than we do, and I think we should have a more honest discussion about that. Very difficult, because every time anyone proposes it, the Liberals are the only ones who've been brave enough to propose it in national elections, and they constantly get turned down as a result. So I don't know how you go about it, but I think we need to do that. We need to have more collective investment in order to solve any of these things. And as I said earlier, I think we need to be expanding provision for the elderly and the less able in Lochaber. That's it.
Thank you, Susan. We'll go to Nathan.
Right. So I think, one of the big issues is, of course, in all of these is, there's, as local government, you are obviously quite limited. I think that's part of the problem that there is that, so much is decided on a much larger scale than you can do, because in an ideal world, I'm sure everyone has a perfect idea of how to fix the NHS, how to make it more efficient and all these other things. But in reality, on a local level, that's not something particularly that is as easy. And so really, I think for better access to healthcare services, obviously, especially we're talking about the elderly and folk who are maybe, disabled or lesser able in this circumstance. I think really it comes down to some of the points we've already discussed: a more local, smaller, inclusive government, a better sense of community, better transport, things that are going to help these people, on a larger scale. I think there is some, potential change that can be had, but I think it would have to be a nationwide thing. I think there needs to be serious address about, what we're doing with the NHS. But I say that on a local government, I think that's a slightly above the remit. So yeah, I think for healthcare, I think it would be a case of the biggest thing I would say is to promote smaller, more inclusive communities, smaller areas of council that basically are gonna, I feel anyway, would care more about its residents, would take more better care of them, and be more sympathetic to people's plights and more willing to help, I think would be my solution or my suggestion in that. As I say, I'm sure everyone's got, we've all got wonderful things, and if we could all wave, a magic wand, we'd all have wonderful ideas of how to fix these things. But unfortunately, we are dealing with the hand we're dealt with, and there is the budget, and there is, obviously limitations of what a local council can do in that circumstances. So yeah, I think, just simply having a smaller area that is more sympathetic and aware of individual needs and is more willing to help instead of a more faceless kind of larger scale organization, I think would probably be my suggestion on that.
That's great. Thank you, Nathan. We'll go to Andrew this time.
These are big issues that we've been dealing with tonight, and many of them go beyond what we can do as councillors, and healthcare services, to a certain extent, is one of them, that we've got to be advocates, facilitators, and lobbyists, and use the limited levers that we have wherever appropriate. I firstly would like to applaud the Moss Park campaign group and all that they've done in recent weeks. That was Lochaber at its best, completely non-political, with politicians of all sides involved in various ways, in both in public and behind the scenes. But above all, it was a grassroots campaign that advocated for the need to save Moss Park. But of course, we shouldn't be complacent, because fundamentally, the social care model that we're dealing with in the Highlands doesn't suit our rural needs. The funding doesn't take into account the rurality, and whilst Moss Park might be saved, who knows that we could be back in similar positions in the future. And from a councillor's point of view, I think we actually need to change the attitude of some of our Highland Council officers, one of which told me that the council's role was to concentrate on care at home. And another senior councillor told me, and I spoke to him about Moss Park, that he was leaving that to the council officers to deal with, rather than taking an active role themselves. And I hasten to add, that wasn't a Lochaber councillor. Because there's a clear case that we do need places like Moss Park to act as an in-between, to relieve the pressure on places like the Balford Hospital and the delayed discharges that we see here in the Highlands. And that's why I think it's important that, having found, so it seems, the solution for Moss Park, we should be putting the case for a much larger care home here in Fort William and other areas around the Highlands need it as well. And then we have Balford Hospital, which I think councillors of every political persuasion have been involved with the various campaigns for the Balford Hospital over the recent years. And I hope that after the Labour Party budget earlier this month, with the increased capital funding that is coming to Scotland, that we can put the case to the Scottish Government that Balford Hospital should be one of those priorities for that capital funding. But that, of course, requires NHS Highland to say that it is top of the list of their capital projects, which my understanding hasn't been the case up until now.
That's great. Thank you, Andrew. Go to Rebecca.
Thank you. I've made it crystal clear from the very beginning that saving Moss Park was a top priority, and it's abundantly clear that it was the only way we were going to have sustainable care in our community for our old folk. But where I would disagree with Andrew is that home care and care at home is a very important part of that. My mother-in-law has dementia, and keeping her at home for as long as we possibly could was a key part of that. Again, I'm going to come back to that idea of, if we haven't got enough home carers. If you speak to home carers on the door, there are people working double shifts, 7 till 2 and then 4 till 10, to cover the needs of people at home, and it's not covering the needs of everybody at home. And when families become under that pressure, that is when pressure starts to build in other areas of the service. So it's about all areas of care for social care for the elderly and disabled, from home to a care home to hospital. And dealing with that would help to deal with delayed discharges at different steps. I also would say that, we have 2 care homes in very close in Lochaber. We've got Abbeyfield, which is a third sector model, which constantly comes in the top of the care homes in Scotland. So there are other models. It doesn't have to be that it's an NHS model and a public sector model. It can be a third sector model that can be very successful, and that would be a very good example. I also liked the fact that at that meeting, you could hear a very solution-focused approach from the Deputy First Minister when she came in. She was absolutely about a can-do, open mind, positive attitude. I think that being at the protest and listening to those families. They were absolutely resonating exactly my feelings and Peter's feelings about how important it is for your loved ones to be close to you and to be able to visit them. A gentleman who was there who had been married for 53 years, had known his wife since they were 16 and childhood sweethearts, and that, visited his wife every day. It's crucial that we, as Nathan said, that we keep our care local, so that that Dalmore is opened in Strontian as well, and the families in Strontian are also able to visit their loved ones every day. We should be looking at localized solutions for sure. And we also need to think about, like, home carers at the moment doing ridiculous amounts of traveling and the travel time. So it's, again, improving those local networks and having genuine patient-centered preventative and rehabilitative care in each community, reducing time spent commuting and increasing the amount of time people spend with people rather than traveling. And increasing the number of carers, if you like, in those local areas. And to do that, again, I'm going to come back to childcare. As you make it possible for people to go to work, we will actually increase that workforce.